Um, Today we'll be going to discuss about gatro-oesophageal reflux. When a baby or a child has gatro-oesophageal reflux, the food and drink travels down the food pipe as normal. However, some of the mixture of food, drink, and acid travel back up to the food pipe instead of passing through the large and small intestine. As the food and drink is mixed with acid of the stomach, it can irritate the lining of food pipe and making it sore. This is called gastroesophageal reflux disease. What is the cause of gastroesophageal reflux? It's a very common in first few weeks and months of life as the sphinctering of the muscles at the base of the esophagus has not matured yet. Many babies with reflux gradually improves as they grow, particularly when they start to eat more solid food and feed in the upright position in a high chair, for instance. In some children, however, reflux continues. This is caused by a combination of factors which may include wider than the usual opening of the diaphragm around the esophagus and a weakened sphincter. Children with developmental problem are likely to continue to have this reflux in childhood and adulthood. What are the signs of gastroesophageal reflux? Main sign is that frequent spitting up or regurgitation after feed. This is often accompanied by abdominal pain or general crankiness in the hours after feeding. Over time, babies with reflux may not gain weight as expected. That is called failure to thrive and may have frequent chest infection due to aspiration, the stomach content into the windpipe and lung. The inside surface of esophagus may become inflamed due to contact with stomach acids, which may lead to scarring and narrowing. Basically, there are different ways that can be, diagnosed um, by the specialist with contrast study, gastroscopy, mammometry, or pH impedance study. So, how it is treated, that is important, isn't it? Initially, child's feed and feeding pattern adjusted to the small volume, frequent feeding, and position like sitting upright position. These are the initial things um, that usually helps. Other options, switching to feed formula and try less lightly caused reflux, adding thickener agent that so that feed cannot go back to the windpipe. Now, medication can also be suggested. Um, so that is that some of that medication that commonly used is Gaviscon, like acid controlling agents, or omeprazole, that also used. What happens like in some children, symptoms associated with gastroesophageal reflux disease disappear without any treatment, usually by the age of 2. However, in some children, it is a long-term condition, can have serious effect on both child and family's quality of life. The option for treating esophageal disease are improving all the time with new medicine and surgical option being discovered alongside a better understanding of why the child develops the gastroesophageal reflux disease. Most children see an improvement in the symptoms, especially after flight duplication operation, although some long-term effect may continue to be troublesome. The child will continue to reviewed regularly by the local team. Hope this healthy talk is helping you a bit to increase the awareness. We'll come again with another topic next week. Bye for today.